another interview series about OTs practicing in non-clinical settings and non-traditional settings. And so today I have a special guest, Sarah Breszkiewicz, an OT from Austin, Texas. Yes.
Yes, you are
Oh my,
right. Austin, Texas.
yes, that's right. Because I was like, man, it had to be somewhere in Texas, and I'm gonna pick one of the big cities. So,
You got
so
it.
Sarah, welcome to the series and for being with us today. I would love for you to just introduce yourself and kind of kick us off, kind of telling us about your OT journey and what has led you up to this point.
Oh, Phil, I am so excited to be here. I just love this platform and the message that you're spreading about non-traditional practice areas. So super, super happy to be here. My OT journey starts in the Midwest, actually, because I'm a Midwest native.
Let's
I
go,
started
Midwest.
working, yeah, I know, right? Yeah. I started working professionally in Chicago, and I think coming out of OT school, I didn't really have a lot of direction. I knew I wanted to work with an adult population, and that was pretty much it. So I found myself working in inpatient rehab, ended up specializing in stroke and brain injury. I just really loved the complexity of these conditions, and I think a lot of the institutions I worked with, like Shirley Ryan Ability Lab in Chicago, was really helpful in bringing to light how data and what we gather through our assessments can really guide the interventions that we do. So, did a little bit of work in clinical research while I was there as well. When I did move to Austin, Texas, I continued in inpatient rehab. But what started happening in my career is the shadow of burnout kind of caught up with me. So, burnout clinically, I mean, what we do as OTs, especially in inpatient rehab, can come with a lot of emotional toll, and just being in the trenches with our patients in that way. Um, the year of the pandemic was a big issue for all of us working in direct patient care and beyond. And then on top of that, I just was really at a high point with a lot of issues surrounding racial justice and social justice, both within the healthcare system and just what I was confronted with as a practitioner. I, in my own lived experience, I've experienced many things, but I think when you're also confronted with that professionally, it just further heightens some of that burnout for you. So I wanted to pivot in looking at what are other ways I can use my clinical skills as well as my passion for data and analytics that I kind of gained through research and other places I've worked. And that's kind of what led me to looking at health tech. And so now I work as a clinical advisor for a startup company called Cincy AI. They are using audio-based artificial intelligence within the home care industry to help in-home care providers optimize their care and really support their clients, largely seniors, aging in place and being as independent as possible. So I kind of work in consulting those groups and agencies on how to use this data and really make powerful change for the people they work with.
Wow. Okay. So that sounds amazing how you were, kind of just thinking about like in every clinician's journey, there's a point that, man, there's something I have to wrestle with here. And you have to like OT yourself to like, how am I going to stay afloat and while take care of myself? And you're kind of like taking your passions and pushing it through and using it in a startup. And you use the words AI, which that's kind of big thing that's happening in the world of OTA and beyond, right? In our lives is AI. And so how are you sort of utilizing AI in kind of the home health setting? Is this like a Amazon Echo that follows you everywhere, or this like drone or something? Like help us understand what that kind of looks like.
Yeah, you're right. AI is such a like hot topic right now, and I think it's out there literally everywhere, and it's been with us for a long time. It's just I think people are looking at how it can be applied with a new set of eyes, so to speak. So I'll kind of break it down how we're using it. So we are an audio-based platform, and I think an Amazon Alexa is an interesting comparison that you brought up because We do have devices. There's three of them that are within a person's home. You typically put them in high traffic areas like a bedroom, a bathroom, or a living space. Unlike an Alexa, which really requires you to give it a prompt in order to get information back to you, our devices are passive. So they analyze all of the audio that happens within a home. And from that, the AI is trained to really extract from everything that happens only what it's been trained to identify as care related. So, when we think about how are we, filtering through everything that happens in the home, that care related training is what really helps us capture things that can be related to health and well-being, whether it be respiratory difficulties, pain, or physical issues. It's been trained to identify emotional and cognitive changes, as well as specific interactions between a caregiver and client. So these are short snippets of information that we're talking about. It's not something wide, but it does allow the agency, when they then get access to that on their dashboard, to be able to review what is care related and make next steps and decisions based off of
Wow. I mean, just even hearing you talk about that, like as I've worked in home health before, sometimes we're in the home for like 30 minutes, right? But we're only there for 30 minutes out of the, 24 hours of the day. So what you're saying is like, this is such a tool that is kind of like constantly there, but also is sort of helping us be proactive and collecting that data and then really pinpointing like, hey, this is what this individual is experiencing or saying, and then be able to address it pretty immediately, right? Is that for the most part
that.
correct?
I love what you said about how, we can't be there all the time. And even if you do have, let's say, a 24/7 caregiver, that person still isn't, can't be present and with you 24 hours out of the day. That's just not humanly possible. So this does provide that window or lens into what's happening during care hours, outside of care hours, when the clinician is present, when the clinician's not present, to give someone a more 360 view of the lived experience of that person. And then, help when you do provide that in-person care, or when you do follow up with them, to be more targeted in the time spent, but also the questions you ask to get more information about what's relevant to those needs and actions. So it's really there to augment the services being provided, and be another tool to fill in any gaps, because again, there's no way that you could always know what's going on all the time, and even a client might misreport or misremember certain things. So I will like qualify that my company and my role, we primarily work with care agencies. So it's not always going to be necessarily a home health company. So it could be a care agency that does have clinicians that work in a home health component of them, but we're really working with the agency and the care managers that oversee all parts of care. So I would say, if you are, let's say, a home health therapist that's working with an agency that's using a tool like this, there is a way for the agency to share reports that kind of highlight larger trends or big ticket issues that the person's experiencing. And then as the clinician, you could take that information to better identify, okay, the agency is telling me this person is really struggling with transfers, and I know I'm providing therapy services to that person. I might then prioritize transfer training, or also then communicate back to the agency specifically the strategies we're using, so they can carry that over when you leave and when you're not there. And I think it's helping bridge the gap of, when we think of interdisciplinary care, between what's a home health therapist doing for the client in the home, what are the needs of not only the client but the care providers that will have to support them in carrying that out outside of your treatment session, and how can we now communicate better about the service that's being delivered, the experience of the people carrying out that, and, during other hours of the day, and when no one's there, how's the client doing with that? So that, visits, home health visits are just being cut, right? So how can we now truly make your time spent even more valuable and meaningful for the client throughout all phases of their life?
Wow, such a holistic approach when you can like when what you just said. That's what I was kind of like thinking. I'm like, wow, the communication. I mean, there could be so many points of breakdown, right? You think about communication within different disciplines, right? But this is kind of bringing it all together.
Yeah.
Fascinating.
And I'll mention too that while my system primarily works with home care agencies, I do know that there are many forms of remote patient monitoring that I think any kind of clinician, regardless of your practice setting, could really make use of. That can be as simple as a wearable device that maybe your client owns, or looking at some other apps that are out there that you could maybe integrate into the way you provide your services and interventions to give you more of that holistic picture, even if it's just vital signs or things like heart rate and respiratory rates. There are lots of implications to that. What's happening in the environment when I see that there are spikes in heart rate for my client? And how is that affecting other facets of their holistic health, and how can we empower them to not only self-manage that by monitoring, but really understand the bigger picture and implications of that. And I think these applications, what they do really well is give you a visual, but also help give an indication of the relevance of that information to other things that you can fine tune that messaging as the provider.
We still have to really utilize our clinical reasoning skills with that, right? And then like kind of go back and forth, see it, what are we going to do with it, and then apply it. Yeah. So
It is a back and forth. It's an
yeah,
engagement. It's like a conversation
yeah.
with the AI platform, however that tool is. So I definitely think you're right.
So it's definitely not replacing us. That's what we could say, right? it's not, it's
It's
no.
not it's not replacing us. Not no, not in anytime soon in the foreseeable future. If anything, I think that it will help us do more of what we want to do, engage with our clients and patients, and less of the grunt work, whether that be documentation or trying to brainstorm like what are the next things I need to be thinking of. Let AI do that part and let you do more of the engagement and being with your person.
Yeah. So kind of almost sort of getting back, helping us get back to sort of the meaningful occupations that we enjoy, right? Treatments, the conversations with individuals, but definitely have this tool to leverage and to like, gosh, like when you talked about earlier about burnout, like I just think about school's experience and documentation and just like, oh my goodness, and how just taxing that could be. But yet, if and when we can refine these and utilize AI to kind of help bridge that gap, like, man, if we could find any way to reduce the burnout, simple things like that, that's huge.
It is huge because across all settings, we're being asked to do more with less time or
Yeah,
with less resources.
right.
But the burden of the admin that comes with that never really seems to get less. It always seems to get more as well. So, finding ways to, I challenge any therapist from any setting to maybe think about what are the things that are hindering my ability to really be present with my clients today and to enact my practice in the way I want to, and then see if there's a tool or an AI support out there that can help augment you or maybe offload a little bit of that so that you can be more efficient.
So Sarah, thank you for sharing that. It is a lot of information. I'm sure. So I'm my assumption is that if people want to ask you more questions, they could just reach out to you, right? Obviously, I hope, or not. Don't contact her. just listen to this.
You
That's
you you are welcome to reach out to me on LinkedIn. I will say that I do my best to respond as I can. So don't take it personal if you've reached out already or you do in the near future and I haven't quite messaged you back. I try to, maybe I need an AI tool to
it.
help
Yeah,
me look
exactly.
across my landscape and know how to respond.
Yeah, wait, once you develop that, let me know because I could probably use that too. Sorry for
Well,
anybody who's my bad. I'm a bad like texter. That's like notorious. Maybe that's a millennial thing, but it's also I'm notorious. I need the AI texting. So okay, going back. So we have been talking about in this series about just non-traditional roles that roles that OTs have kind of ventured into. Obviously, this is probably something you did not expect to be in when you were in OT school. Did probably even know this was an option, right? We come from underrepresented communities. That's just fact. It's data driven on AOTA. AI can pretty, shoot that out real fast. But I'm sure our journeys are very different. And so I would love to kind of hear more what that has been for you and what that means for you.
I'm so glad again that I'm able to speak on this platform that you've created because it is something that matters. And I think visibility in all forms is so important because we can't become the inclusive practice that we want to be and service the clients to the best of our ability if we're not reflecting diverse voices and bodies and people in all forms of what we do. So for me, when it came to like discovering non-traditional practice settings, I remember really vividly, I was in a in service and inpatient rehab, and an OT came to speak to us who worked in robotics. And she was talking about how she was the only clinician and therapist on her team that worked closely with a bunch of engineers. And I thought, how does an OT find themselves in a room full of engineers? It fascinated me, and I never quite let that go. And so when I decided to look at other opportunities, I saw health technology as being a really wonderful industry of great ideas that impacted populations and people, but maybe was lacking in the clinicians and that lens to really support those products continue with their development and really cashing in on what they sought out to do. So I think that all goes to say that for any therapist that's looking for, a next step or maybe something outside of the traditional setting, I think the first thing to do that I found helpful was find what interests you, both in what do you like about being a clinician today and in the role that you're currently in, and maybe what opportunities are you looking for that you're not finding within wherever you're working currently. And then also think about what either population do I really like, or what types of impact am I looking to make? Because I think that will help guide you in discovering companies you might not have ever heard of, or opportunities and options that you might not have ever thought about that you can definitely apply yourself to. And the final thing that I think OTs are always working on is there's the joke of the OT elevator pitch and how it can be really hard to describe what OT is at times. But I think it comes back to feeling empowered to not be afraid to sell yourself and articulate the true skill that it takes to be an occupational therapist, and how that can directly or even indirectly relate to these other roles and opportunities out there. Because I think I often see us being very humble in what we do because we're not the star, the client, the patient is.
Right.
But ultimately, you do have to show why you're the star in order to, I think, land in some of these more non-traditional roles.
Mm. I like how you said being the star, and then like being in that position again is not normally something we're used to, but yet I think like what you have just mentioned, like that's where we have to shine though, and that's where we have to show our value because we do have something to bring. And then if we want to even grow OTA as a profession, we sort of kind of have to infiltrate other areas that people are familiar with, right? Because we're not here to help people find jobs. Like that's we're more than that. What would you say is something that helps you kind of keep going? Like, what do you draw from? Because I mean, again, this is really new. So where do you find your supports to like keep pushing forward?
That's a really good question. And I don't think I've ever quite been asked that
Oh,
before or recently. Yeah. I think what motivates me is my quest to learn more. I don't like operating on autopilot. I like stretching myself and challenging my brain. So that's what's kind of motivates me to try to continue excelling and thinking outside the box with what more can be done. I would say what also motivates me is I am often used to being the only person of color in the room. And I think there's great, when I say power, I don't mean personal power, but I think power for others to see faces and individuals that they see themselves in. And so I also want to continue to, as I enter non-traditional spaces, be a voice and have a platform to showcase how OT, while it can still improve in its representation, there are still people today working in all different fields that might represent you or might, be a personal connection for you. And so I really want to motivate others to continue going down the road of exploring OT and continue going down the path of exploring other options within OT so that they keep their fire for the profession along the way.
Yeah, I totally agree with you. I think about just reflecting this past conference, many of the students that I talked to and just them sharing like, hey, I'm just so glad that there's somebody that looks like me and that knows the challenges that, we experience. And sometimes that being a representation, being present is already a huge lift for their spirits, for their continued pursuit. So my encouragement to all of you, if you're watching, if you're minority practitioner, like, is you got this, you can keep going, and we're here for you. Like, this is a community that wants to give back to you. You know, we're not by any means like experts in anything, but we're gonna be pushing for you, and we're paving the way. Because I know, for personally, again, my kid, like, when I don't know if she'll be at OT, but maybe she will. Like, I hope that I have made that path a little bit easier for her. So, but Sarah, I really appreciate your time and you sharing your story. I think there's just so much that you are already going to be doing and more that we're going to hear your name at more conferences and more things. So, and then especially if you can create that AI for my texting situation, that'd be great.
Maybe, yeah, maybe next time you'll see that I have my own company started with different applications of that. But Phil, you are truly just such a joy, and I just appreciate again you even taking this platform on to showcase these different stories. And I have no doubt that this is going to be a really big impact and support for current and future practitioners to come.
Yeah, definitely. Thank you. I appreciate that. Well, everyone, thank you so much for your time and have a great day, and we'll see you later.